when we were looking at breast cancer specifically within the Hispanic subgroups, we did find a couple of disparities or differences in the uptake of palliative intent treatment. And so, from our retrospective cohort analysis, we did find that the patients of Puerto Rican descent had the highest proportion of use of palliative intent treatment, and that patients of Mexican descent significantly had a reduced use of palliative intent treatment. We also found that there was a reduction for patients that were of South and Central American descent. And so these just kind of results or disparities show that there was a difference in the usage of palliative intent treatment, which was something that our study kind of illuminated. And it was really interesting because there are differences within those disparities. So the numbers and the different subgroups and how much they use palliative intent treatment changes per cancer type, which was really interesting, also of note. And then as far as clinical implications go, palliative intent treatment or palliative treatment has been shown to improve the overall survival and also quality of life for patients, specifically with cancer as well. And so I guess the clinical implications of this just goes to say that these disparities for Hispanic subgroups do impact the continuum of care and just long-term care as well. And it's something that should be focused on in the future, especially as research into these disparities kind of continues. I think that a lot of strategies that we outline or we kind of were brainstorming are more holistic. They're not specifically tied to one type of cancer, although I'm sure that there are kind of mechanisms to tie them to specific cancers, but that's just not something that we got into specifically. But I know that the first and foremost, I guess, strategy to combat these disparities is just more research into the disparities, partnering with other researchers that may have other qualitative measures that we could kind of do an analysis that way and look in it and tie it specifically to breast cancer. I think we, with the National Cancer Database, we were able to kind of find patients with specific cancer types and do the analysis that way. But if there was more research into Hispanic subgroups and disaggregated Hispanic subgroups, I think that more conclusions could be made. Another potential strategy was just in our study, we focus a lot on the importance of including community, family, and caregivers into healthcare decision making. And so that's something that could be highlighted and could be focused on more in addition to just more patient engagement in these programs as well. But that's not specific to just breast cancer. I'm sure we'll get into that more with the next couple of cancer types. It's just something to focus on more and more in the future as we develop more research on this.